Hi guys, you're welcome back to the channel. Now, this is a woman's reproductive system. You can see female reproductive system over there. Now, today I'll be talking about how fibroids can prevent a woman from getting pregnant. You might be trying to get pregnant without knowing if you have fibroids. Now, if you have fibroids, it is not something that you just use your eye to know or use your arm to palpate. I mean, when I mean palpate, mean like just touching your abdomen and knowing that you have fibroid. Okay, I know the most common sign of having fibroid that some people talk about is when your abdomen is big and all that. But no, it's not all cases when abdomen is big that a woman has fibroid. Okay. Now there are other signs and symptoms of fibroid which include you know heavy bleeding. But today we are not going to be talking about the signs and symptoms of fibroid. That's why I will advise you that if you think that you might be having fibroid, you need to visit the hospital, visit the gynecologist and run some scan. That's the only way you know. But today, let me educate you about how fibroid might be preventing you from getting pregnant. Now, this is the woman's reproductive system. You can see the uterus upper there, then you can see the vagina. This is the vagina down here, and then the cervix over there, then the fallopian tubes, those things that look like thread, like the fallopian tubes, and then those things that look like egg over there is the ovaries. Okay, now every month a woman always release an ovary into the fallopian tube, which is called our ovulation period. Now, know this ovulation can actually happen in both fallopian tubes, okay? That is, eggs can be released to both fallopian tubes. If you notice, we have the right fallopian tube and we have the left fallopian tube with the right and left ovaries attached over there. Now, when your both ovaries release eggs into the fallopian tubes, and then during copulation, that is during sex, and the man's sperm cell swim down to fertilize both eggs, that's when you notice that a woman can have twins. Okay, and that's not the only way a woman can also have twins, because a woman can also have twin, identical twin, if one fallopian tube was fertilized and that particular egg divide into two, okay, creating two babies. Okay, but the one that is being produced from two different fallopian tubes are the ones that are non-identical twins. Now, we're not going to be talking about twins today, but I'm just trying to explain one or two things to you people. Now, let's talk about how fibroids, affect a woman from getting pregnant. How do they affect a woman from getting pregnant? I'm going to be putting picture of fibroids here, different type of fibroids, and I'm going to explain. Now, when sex occurs, a man release his sperm cells into the woman, through sperm, right? That fluid, that liquid you see as sperm, it will be released into the woman. When the man has already released it, the sperm cells will swim into the cervix from the vagina that it was released. It will swim into the cervix. From the cervix, it will now swim into the womb. From the womb, it moves down to the fallopian tubes to get the woman egg fertilized. Now, remember, as I said from the beginning of the video, I said the eggs are usually produced, that ovary is what I'm calling the eggs now, they are usually produced, okay, during your ovulation period, where a woman, that's not your safe period. Okay, whether you're married or not married, that is your unsafe period. When you're ovulating, that's the period where you get pregnant, when it's being released. And then when the lucky sperm cell touches any of the egg that is being produced, okay, that's when fertilization occur. And then the ova, that's the fertilized egg, will now move down to the womb, that's the uterus, and get implanted over there, and then start forming a baby. But in a case whereby fibroids are blocking certain places where this fertilization process can take place, that's when a woman might not be getting pregnant because she has fibroid. Now, let's talk about the type of fibroids here. Now, those things you are seeing there, those round stuff that are ash color, they are the fibroids. Okay, now, we have fundal subserosal fibroids. That one is found in the fundus, of the upper part of the uterus. And then we also have submucosal fibroids. You can see that, it's inside, the womb, but the fleshy part, not inside. Okay, you get. And then you see another fibroid that is also inside the womb. So I don't want to bore you with medical terms. Let's just say that if this fibroid appears in a place where it's blocking your cervix, my dear, fertilization will not occur, because where would the sperm pass through? And then if these fibroids are blocking that other entry to the fallopian tube, fibroid is there blocking it, sperm cells will be deposited into you, and sperm cells will not go anywhere. They will just be rotating around, and then they will die off after some days. Now, so you see why sometimes a woman can be medically okay, blood work, everything is okay, but fibroids are the ones preventing her from getting pregnant. So if you have fibroids, you might want to look at it. And some women can still have fibroids and still get pregnant. Not every fibroid case that prevents a woman from getting pregnant. I'm just here to show you that sometimes, due to the how large the fibroid is, it might be blocking the entrance of sperm cells, and it will prevent pregnancy. Without your husband's sperm cells, pregnancy cannot occur, because even if the woman is producing eggs and ovulating the right time and the right way, she will not get pregnant. I hope you learned something from this video. Now, this is not me saying that only fibroids prevent a woman from getting pregnant. Now, women are very funny. When you make videos like this, they just automatically feel that, oh, the reason why I'm not getting pregnant is fibroid. No. And that's why I mentioned blood work, okay? Now, there are certain tests you need to do to know if maybe the issue you're having is something else. There are different reasons why women don't get pregnant easily after marriage, okay? There is what we call PCOS, polycystic ovarian cysts, that's what we call hyperprolactinemia. Okay, when you have too much prolactin in your blood as a woman. Normally the prolactin is actually an hormone that produces milk for babies. So if you have not gotten pregnant, why are you producing milk? So there are some women that have the tendency of producing milk, okay, when they are not even pregnant. So your body automatically, the body system is now seeing you as a breastfeeding mom. So therefore, pregnancy will not occur, because the hormones to make the woman now ovulate normally, okay, will not now occur, even when she doesn't have fibroid. Now, there are a lot of things. I will not want to bore you with this one. I might use this hyperprolactinemia to make a video, or talk about PCOS in general, okay? There are so many things. Infections too can make a woman not to get pregnant. There are so many things, okay? This one, I'm just talking about fibroids generally. So don't think because maybe you're not getting pregnant, you automatically think you have fibroid. And if you think you have fibroid, you're having heavy menstrual cycle, you're having heavy bleeding, why not see a doctor, see a gynecologist, run some tests, run some scan, and then you will know the true picture. And again, whenever you're running this test, we always advise women, carry your husband along. You remember, as I was talking here, I said only a woman cannot get herself pregnant. The man need to be involved. Now, let's not see a scenario whereby the woman does not have PCOS, she does not have fibroid, she does not have infection, she does not have even hyperprolactinemia, she does not have anything blocking her way, and the man's sperm cells are not active. Do you think pregnancy will occur? No. The man will just have sex and be pouring what you think is sperm inside of you, but no sperm cells active to swim, to fertilize it. So you see, when a woman and a man, they are looking for babies, it is a teamwork, not just the woman running from one hospital to the other. They might be treating you, whereas your husband have a bigger problem. So you see. Anyway, let's end the gist here. Next time, I will come back with another video talking highly on hyperprolactinemia, when a woman is having the hormone that produces breast milk when she's not yet pregnant or being a mom. Remember, all these issues are treatable and manageable. So therefore, always visit the hospital, meet your gynecologist, and do the right test. Thank you for watching. Please subscribe to the channel. Bye for now, guys.